Kwansah Ndemo. And actually, I'm a protege of my father, Professor Kwansah Ndemo. We were both trained at University of Minnesota, the creators of pharmaceutical care. So, Professor, I look forward to getting to know you better. Do you have a better microphone? All right, mic check. Okay. All right, so today I'm going to be very brief. I've really been impressed with the previous speakers, with the senior members of our pharmacy profession in Kenya. I'm really inspired. So I represent the young pharmacists, okay? We are the future, okay? We are the future. And we're in a period of very challenging times. As we've alluded to that, this is a high time we start focusing on pharmacy practice, okay? Beyond just the knowledge, we need to apply our knowledge. So for me, I'm actually pursuing a second degree in public health, and I strongly believe public health pharmacy is the future. Okay, this is very important, and you're going to see it in my slides. So antimicrobial resistance was introduced to me through the public health program. Okay, I wasn't fully aware about that when I was in school. So this is an area pharmacists can shape pharmacy practice. So let's go to the next slide. So the focus is on medication management. So most of you will ask me, what is a medication management program? So for me, I look at the bigger picture. This is not medication therapy management. To me, this is my opinion, MTM is at a practitioner's level. When I say medication management, I believe this is a system-level solution to manage the distribution, supply, and use of medications in any healthcare system. This is very important, with an ultimate goal of improving patient care outcomes spearheaded by a pharmacist. Okay, I came up with this definition because I've been frustrated as a young pharmacist. In all the meetings, there's no conversation about a pharmacist spearheading those programs. Something to think about as you guys get employed out there. Let's go on to the next slide. So as you well aware know that antimicrobial resistance is the ability of microbes to grow in the presence of a drug that would normally kill them or limit their growth. Drug. Pharmacist. Okay? AMR reduces the effectiveness of the drugs. Pharmacist again. Okay? Making it harder for the body to eliminate infections. Okay? This affects patient care outcomes. Do you see what is going on here? This is our area. We need to take it. We need to own it. Okay? Now here's the outlook. So, as you can see, there's a shift going on in the pharmacy profession. Look what happened here. Antibiotic use has been going up. So antibiotics are readily available and their use is increasing every day. Okay? But look where pharmacy was before. Drug discovery. Okay, that's what we've been hiding. But that has slowed down drastically. Okay, so we flooded the market with all these medications, but there's a gap. Who is managing those medications? Things to think about. Let's go on to the next slide. So here's an outlook on what's going to happen with antimicrobial resistance contributing to deaths globally. Currently, it's estimated that antimicrobial drug resistance, contributes to 700,000 deaths globally per year. But now the predictions, look at that, 10 million by 2050. It's going to outpace cancer. All right, let's go to the next slide. And there you see it. They estimate AMR in 2050 will contribute to 10 million deaths per year globally. And look where cancer is at if we do not address this issue as pharmacists, in collaboration with other healthcare providers. But I strongly believe pharmacists should be taking charge and being leaders in this area. Okay, we shouldn't sit on the sidelines and we shouldn't take the backseat. Okay, let's move on. All right, let's look at the problem today. So, as you can see from my slide here, there are challenges collecting data in developing countries. So the data I have is from Europe and North America. They estimate 50,000 lives each year is lost to AMR. But look at that, the number could be high in other parts of the world. Are you surprised? Okay. Now look at the economic costs of AMR. Okay. A significant reduction of 2 to 3.5% in GDP is expected to be seen. Now the reason I put this here, because I graduated in 2009, and there was a major shift in America. Okay. They had estimated there would be a lot of jobs for us, but all of a sudden, I had a lot of friends who were jobless for a year. Okay? So right now the emphasis is to save on healthcare costs, and hopefully they'll pass those savings to us to keep us employed. Okay? And that's why I mentioned that. Alright, let's go to the next slide here. Look at AMR's impact on the world GDP. Alright? They estimate there'll be $100 trillion lost. Okay? If we can save this, hopefully the organizations we work in will pass those savings to us and keep us employed. Okay, so a lot of my friends come to me, I don't have a job. But we need a lot of leadership, policy, and shaping out there. Okay? Alright, let's go forward. So now these are the challenges in the pharmaceutical sector for developing countries. Alright, and I've actually observed this. I came back to Kenya last year, alright, in August, and I actually see this, okay? So look at the first one, inadequate monitoring of prescription use. The next one is lack of patient records in pharmacy settings. Antibiotics are available over the counter. You can purchase them without a prescription. I have done that. I'm ashamed. Okay? The next issue is limited diagnostic facilities and non-prescription use of antibiotics. And lastly, patient medication seeking behavior. If you don't see pharmacy in this slide, I don't know what I can tell you. This is everything to do with pharmacy. So here are the solutions I believe that pharmacies have. We have these solutions. Alright? For inadequate monitoring of prescription use, that is medication therapy management as a solution. Okay? For the next one, lack of patient records in pharmacy settings, IT solutions. For antibiotics available over the counter, I strongly believe electronic prescribing can solve this for us. We can innovate here. Okay? And we can collaborate with physicians. For limited diagnostic facilities, I believe in telemedicine. For non-prescription use of antibiotics, there is public health pharmacy. And lastly, for patient medication seeking behavior, medication therapy management again. Let's go on to the next slide. So for me, in my perspective, alright, the solutions require the pharmacy profession to be spearheading these medication management programs beyond MTM, beyond drug therapy. We're creating our practice environment. Okay? So MMPs are system-level solutions that need pharmacists to be positioned as decision makers in implementation for healthcare organizations. Okay? This is a big area for me. This is where my passion is. I feel pharmacy leadership has to now take charge in shaping our profession. And lastly, medication management programs require governance, regulation, accreditation, and guess what? Political will. Political will. Alright? So these are the stopgap measures I want us to think about for tackling AMR. The pharmacist practitioner. The pharmacist practitioner. Pharmacists need to be actively processing prescription orders. Okay? We need to be actively doing that. Pharmacists need to be creating and maintaining personal medication records. Pharmacists need to collaborate with other healthcare providers and lab diagnostic facilities. And lastly, pharmacists need to be monitoring patient care outcomes. Alright, this is where our future is. These are the activities I'll be looking forward to be doing once I get licensed in Kenya. So let's go on to the next slide. And this is the last slide that I got from my Master in Public Health program. Alright, it really inspired me. Okay, so William Fogg is an American epidemiologist, and this was his quote. Okay, all public health decisions now are political. You can separate the science of public health from politics, but not the practice. All pharmacy decisions now are political. We can separate the science of pharmacy from politics, but not the practice. Okay? So we need to be involved in policy. We need to be involved in leadership. We need to stop sitting on the sidelines. All right, thank you.